Good afternoon. Thank you for being here with us. Today we will present the experience we are doing in a big European funded project. The name of the project is IDEA4RC. This project deals with making data available for rare cancer patients and rare cancer researchers. And the objective is to make a rare cancer care more viable, more, let's say, effective, and improve the life of these patients, okay? Here we start with the presentation from the, let's say, scientific point of view of the caregivers and of the patients. And the first speaker is Professor Andreas Muth. He is head of unit of the Sahlgrenska, of the surgery department of the Sahlgrenska University Hospital in Gothenburg. And he will explain to you why rare cancer research is so important. And after him, Dr. Magnus Olsson, who is a former chairman of the Swedish Sarcoma Association, will present the patient's point of view and explain why for patients research is so important. So I give the floor to Dr. Muth. Thank you very much.
Let's be. Okay, thank you. So we'll talk about rare cancers, and the first question is, okay, what is a rare cancer? And rare cancers is a number of cancer diagnoses that are united by the common denominator that they are rare. So to have a rare cancer, the cancer has to have an incidence, that is, new patients diagnosed each year less than 6 in 100,000 individuals. And living with a rare cancer can be less than 5 in 10,000 individuals. Now, there are many types of rare cancers. For this talk, I will exemplify one of the largest groups of rare cancer, sarcomas. Now, so that is a rare cancer. Now, what is the problem with rare cancers? Well, they're rare. So it's hard to get clinical experience. For the patient who meets the doctor for the first time, the doctor will probably never have seen the patient before. It's also hard to make research. Few patients, scattered, hard to make studies. And that comes down to it's hard to make clear and evidence-based recommendations on treatment because data is scarce. Now, the second problem with rare cancers is they are common. Taken together, all these diagnoses, they constitute some 20-25% of all solid tumors, making 1 in 5 cancers a rare cancer. Okay, so what do we do? When we try to establish recommendations for treatment, to advise our patients, we like to have high-grade evidence. Ideally, we would like to have randomized controlled trials or even meta-analysis of randomized controlled trials that answers questions about how we should treat our patients, how we should follow them. But for most rare tumors, this is not the case. For rare tumors, observational data is really the mainstay. That's where we have something that we know about our patients. Now, consider, for instance, this situation. The real problem in rare cancer is lack of data. A few years ago, we saw this male, 53 years old. He had a desmoid tumor. It had started growing into his small intestine with a fistula, and he was getting infectious septic complications. Now, what to do? Well, you could go to the guidelines, so see if you can get any guidance. And we realized that most guidance in this area is of low to very low quality. So according to the grade system. Well, we opted for a bowel resection in this case. He recovered uneventfully and has been without recurrence since. but based on low or very low-grade evidence and clinical experience. Okay. This means that for rare tumors, these are two major groups of sarcomas. We see great differences in survival rates and outcomes when it comes to different centers, different healthcare systems. This is data from Europe from 1995 to 2002, and it differs both because of the geographical location, but probably also because of the system and the knowledge at each center. So we see great differences in 5-year survival rates, and that is only available to do that when we have high quality data to uncover these inequalities of care that we see in rare cancer. The current solution, what do? Well, we centralize. We build local comprehensive cancer centers to gather expertise and patients on a local level. On a national level, we try to centralize. We have 3 centers here in Sweden for sarcomas, much the same in other parts of Europe. And we try to gather expertise in Europe by European reference network centers. So we try to gather expertise and experts and create a network of experts for our patients. Now, how do we go further? Well, we believe that we need to take full advantage of all available health data, and we need to turn this network of experts into networks of data, to harness all data that is available for our patients. Now, we are moving into a world of structured data, but we're not there yet. Okay? So what does data look like? This is from my outpatient clinic a while ago. And what do you see? Well, we still use the dictaphone for speech to text or for through our medical secretaries or through some software. We have image data. We have an electronic health record. It's mostly unstructured text. Down here is some kind of analog digital workflow going on with the pathology department. And here you see a quality register form to somehow get data from the unstructured form to a structured form. So this is what it looks like in everyday practice. Now, what is the process of structuring data? Well, it's manual labor. We gather these forms for a while, and then someone like Josephine at our unit takes the form and enters the data into the database, and somehow, somewhere, we get finally some kind of output to analyze. This is the process. It's labor intensive, takes a lot of manpower, a lot of hours to do this. Now, the IDEA4RC project is aiming at integrating and making use of all these data sources through use of novel technology, large language models to extract all this data. So, as of today, if you want to do and get a registry report, or you want to make a collaborative study and collectively analyze data, you must first reprocess it. In this project, we aim to eliminate all need of reprocessing of the data. So, our vision is that all observational data for adult patients with rare cancers in Europe is made available for research, for innovation, and also for clinical decision making, without placing this extra burden on clinicians and hospital workers, through a simple and transparent mechanism, accessible to all stakeholders, while preserving the individual privacy and the autonomy of the data and the control of the data providers. Okay. This project was modeled around the EHDS to be a potential pilot or a way to demonstrate how this could provide a real-time state of play for cancers across the European Union. So I'll finish off with a film summarizing the project.
More than 5 million European citizens live with a rare cancer. These diseases are not common, yet all types of rare cancers, taken together, make 25% of all cancer diagnoses in Europe. Still, there's much we don't know about them. Highly specialized clinical centers in Europe routinely collect health data to provide the best care for patients affected by these diseases. Such data are a precious resource for scientific research. Each center, though, receives very few patients with the same type of rare tumor. Therefore, their data alone are not sufficient to obtain new insights on the disease course, the effectiveness of treatments, or factors influencing prognosis. However, it is not easy to use data from multiple centers together. They are collected and organized in ways that vary from one center to another. Moreover, accessibility is limited for privacy reasons. This is where the EU-funded project IDEA4RC comes into play. This project aims to develop a specific software. It will allow researchers to easily and safely analyze relevant data collected by multiple clinical centers. Engineers are developing tools to harmonize the data across the centers. In addition, computer scientists, with the help of clinicians, are training AI algorithms to extract information also from texts and categorize them in a database. The database will include an extensive list of variables specifically selected for researchers to use. But what about the protection of patients' personal data? Each center will host a capsule, which is like a digital vault where their own health data will be stored. As an additional layer of data protection, every researcher interested in analyzing the data will need to submit a request. A dedicated software component will handle the request, asking the authorization to every center involved. After receiving the permit, researchers will be able to run analysis over the data using the IDEA4RC infrastructure and tools. They will only have access to the results of their analysis, while the raw data will never leave the clinical center's vaults. In this way, researchers will gather new evidence on rare cancers while keeping patients' privacy safe. Researchers and professionals with a wide range of expertise from 25 institutions spread across Europe are turning the IDEA4RC project into reality. They are working together to make data access easier and get a better understanding of rare cancers. The ultimate goal is to improve the quality of care of all European citizens living with these diseases.
Thank you.